Imagine one day finding out that your elderly family member was given a fatal overdose by someone who was supposed to take care of them. Well, family members of loved ones in a Frisco-based hospice facility didn't have to imagine that.
It was shocking. It wasn't a surprise because that particular hospice was growing so quickly that everybody in the senior community knew something was off.
Joe Alch is the CEO of Acappella In-Home Care and heard the news of multiple nurses from Novous Health Services on trial for giving at least 2 patients lethal doses of a drug. WBAP reports nurses who administered the drug say their CEO told them to do it in order to speed up the deaths of patients so Novus could make more money.
This is not common. Hospice is very specialized. It's not just about administering morphine. It's about getting a patient's pain, physically, spiritual pain, emotional pain, just making sure they're comfortable in all those areas.
For Joe, hospice care is personal.
I was a hospice nurse for many years, and my grandfather, my last semester of nursing school was on hospice. My grandmother did not want him to be sedated, so he died in pain. He was at a hospital, and you could hear his screams for the last 72 hours of his life. And I made a promise to myself I would be a hospice nurse and not allow my clients to suffer.
Joe now owns Acappella, which provides in-home care for the elderly in DFW. She says family members choosing care for a loved one is usually overwhelming.
And it's tough, and I've gone through this not only on the professional end, but on the personal end as well. Say a patient is in the hospital, and the doctor and the family have agreed to just let nature take its course. Normally the social worker of the hospital is given that information. She relays it to the family. They have to give 3 names of hospices to this family. So most people would have no idea who these companies are. So you've got to do your homework. Ask for references. Do your research online. Ask around. Call some communities, call some home care agencies, call the senior source.
She says once you find the hospice that's right for you, the last step is to stay in contact with not only the facility, but your loved one's physician as well.
Everyone is going to walk that journey one day, but we're fortunate in America that we do have the right meds. We have the hospice benefit through Medicare, through Medicaid, and you want to make sure that your loved one is provided that journey comfortable.
For Real News, I'm Sarah Strackhouse.